Hi there, welcome to Mansfield Today. It's a Wednesday and that means it's time to look at matters medical with Dr. Vicky Skitter.
Hello, this is Mansfield Today, the medical show on a Wednesday. I'm Dr. Vicky Skitter and today we're going to talk headaches. And the reason I chose headaches is because it's such a common thing. We all get headaches at some point. We often ignore it or just take a pill and brush it off because it's so common. But there are certain things that I need to mention for you to look out for when you need to sort of go to a doctor or worry about it a bit and let it be investigated further. So the diagnosis of chronic headaches or abnormal headaches can be quite complicated, and you usually need longer than 15 minutes to diagnose your patient because you need a good history. Often you need a full neurological examination and that takes time. And after that, we often refer those difficult patients that we're not sure about to headache clinics or neurologists. Sometimes they end up at the ear, nose and throat specialist or the maxillofacial even. I've been asked before whether the brain actually feels the pain. So it's interesting. The brain itself does not have a sensation. So you can basically operate on someone's brain while they're awake. You just have to get to the brain first, which might be a bit of a complication. But so the brain tissue itself doesn't feel it. The pain usually comes from structures within the brain or head, or structures around the neck area. We like to think of when we try and figure out where the headache's coming from, we like to think of intracranial, which means inside the skull, and extracranial, which is outside the skull, obviously. So examples of intracranial headaches would be like what we call trigeminal nerve system problems, and that's usually your fifth cranial nerve, and it supplies your whole face and ears and sort of skull with sensation. So maybe you've heard of trigeminal neuralgia. That's what we diagnose patients with, if there's a problem with that system. Also, structures in your face, like bones, joints, like your TMJ joint, here where your jaw opens, that's quite common. And muscles in the head and neck area. Also, if you have sinus problems, you can get headache from sinus, obviously, that's quite common. And also eyes and teeth. Those kind of issues can also give you a headache, obviously. So those are the extracranial systems. The intracranial, sorry, I don't know if I mentioned that, but that's, for example, the vessels in the brain. If you've got problems there, like an aneurysm or a brain bleed, also problems with the membranes of the brain, the meninges, when you've got meningitis or encephalitis, that kind of thing. Okay, so as doctors, we try and classify the headaches to make it easier. We try and classify them as primary or secondary. So the primary headaches is usually when the headache itself is the disease. When the only manifestation is the headache. That's usually a problem or a malfunction or disturbance of your pain systems in your central nervous system or peripheral nervous system in your head and neck. So that's the primary one. Now the secondary one is usually a headache is the symptom of another disease somewhere else. So process elsewhere, if we diagnose the disease, say for example something simple like sinusitis, we diagnose the disease, we treat the disease, and the headache goes away. So that's obviously, first prize if we can do that. It's sometimes difficult to distinguish between headaches, whether they're primary or secondary. That's why us as GPs need to listen carefully. And you as a patient, I want to sort of tell you that about a few questions or answers or history information that you should try and sort of realize at home and then, give it to the doctor. So if we do listen to our patient and we do a good history and if necessary a good neurological examination, then it's usually most of the time it gives us a good idea whether it's primary or secondary. So which questions do we ask and which things should you as a patient think about if you've got these chronic, difficult or new headaches that's, you're not sick or anyway. So we'll go usually the age of onset. So you must be careful if you over 50 years of age. I don't know why it's always 50, but over 50, or actually when you're very young and very old. Over 50 is not very old, but if it's a new onset headache, that's something to maybe just, have checked out. Then also the mode of onset, how the headache happens. So if you've got a sudden onset headache, we call it a thunderclap headache. It's usually quick and severe, and the pain goes from 0 to 100% in seconds up to a minute. That's a big problem. Okay, so that you need to be checked out. And then obviously there's other different ones. If it's slow onset, through the day or through months even, that's a whole different story. So maybe your headaches are cyclical to the females, related to your period or to the pill. That's something to think about. So we check the frequency, the intensity, the duration. So for example, a migraine usually lasts longer than 4 hours, but shorter than 72 hours. Okay, and you might get an aura, nausea, vomiting with that. Cluster headaches are usually 2 to 3 hours and then they're gone. And if you think about a tension type headache, those headaches you don't really wake up with them. It progresses during the day. So you feel okay in the morning and then it gets worse, and by nighttime or afternoon you've got like this throbbing headache. And usually they respond maybe to physio and muscle relaxants, so that will give you quite a good idea. Then location, where you feel it. So whether you feel it, at the back of your head, one side of the face, that's also very important. And the quality, so what does it feel like? Whether it's a pressure type, band across the head, throbbing with each heartbeat, that kind of thing. If you think about blood pressure, pulsatile, or stabbing or burning, where maybe you'll think about a nerve problem. So that you can think about. If you've got dental issues, that's also something to mention because that can cause headaches as well as sinus issues, rhinitis, hay fever, that kind of thing. You can also tell the doctor whether there's a difference when you change posture. So when you're lying down or bending down, then, for example, a sinus headache would be worse. So that's postural change. And then whether there's triggers. So if your birth control triggers it, or coffee triggers it, or some medication that you take, maybe, for example, blood thinners, if that triggers it, one can sort of work back and work out that that's the cause. Your history is very important. So if you've had previous clotting problems, like deep vein thrombosis or pulmonary embolus, you worry about clots or strokes or whatever in the brain. If you've had previous cancer, any cancer history, you want to make sure the doctor knows about that, because we always think about metastases in the brain, which is not such a great thing, but anyway. If you're immune deficient or pregnant and you've got headaches, obviously there's a whole different things that we look at then. So all of those questions and answers will help us as doctors to try and diagnose the headache and then obviously treat you accordingly. Lastly, I wanna just mention a few red flags. So certain things that you'll feel that you really need to go and see a doctor ASAP. So that thunderclap headache that I was talking about, that's sudden onset headache is important. Also, when you get an unusual headache, when you get a headache that you've never ever had before, that type of thing. When it's present on waking, if you wake up with a headache, or if you've got associated symptoms with this headache, for example, fever, vomiting, confusion, if you faint with it, if you have seizures with it, that's a big problem. Or also interesting if it's related to exercise or exertion. sneezing, coughing, even intercourse. Believe it or not, if you get a headache during that, it can sort of mean that you might have a problem inside the brain, like bleeding or a tumor or coronary artery disease, so aneurysm. So I'm not saying when you do get a headache when you have sex that the big problem. I'm just saying, you'll know if it's an abnormal headache, or you should know. And then us as doctors, obviously, we should examine you properly, check if there's any abnormal signs like high pulse or obviously fever or blood pressure problems. Then that will point us in the right direction. Or when we start worrying a bit is when you've got neurological symptoms. So if you are paralyzed, or like we call hemiparesis, or weakness on the one side or anywhere actually, when you're slurring, you're not talking well, when you've got neck stiffness, obviously that's a big worry for meningitis or encephalitis. And then something we call ataxia. That's when you sort of walk funny. It's a clumsy voluntary movement, so it will affect your balance and your walking. That's a definite problem. And then if you lose sensation somewhere, or loss of power, and the doctor finds abnormal reflexes, those kind of things, obviously red flags. So I hope this gave you an overview of headaches, and maybe helps you to to think of things to mention to your doctor, or the doctor can, what the doctor can ask you. And that is the end of the show. Goodbye.